Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hi, this is PJ Ewing. Welcome to the Bee's Knees podcast. Well, we're on a mission this week. We've got a podcast every day, each with a very specific point from some experts in their respective fields related to knee surgery recovery, knee replacement recovery oftentimes. In this case, we once again have Lisa Alarcon, a physical therapist in the state of Michigan. She's going to talk about strength, the importance of strength, how strength is related to range of motion, and what you need to do to get your strength back and why it's so important after a big surgery like a knee replacement.
You know that whole use it or lose it? That's real. That really happens. And so if you don't move that muscle, it's going to contract. It's going to stay short because that's all it's ever had to do. And that's why sometimes strengthening after a knee replacement takes longer, because you didn't have that range of motion before. If you had a knee and that knee was only bending to 70 degrees, then the quadriceps knew that it had to work from 70 to 0, and that's all the quadriceps had to do. And the hamstrings only pulled the knee back to 70 degrees. They didn't pull it back any further, right? So those muscle fibers that exist after 70 degrees on either side of the joint, they're on vacation. And they like being on vacation. And when you ask them to start working again, it takes a little bit of time for them to remember what their goal was, what their target was, what their job is. And so we see that being able to kind of miss that mark or miss that loss because we can get that range of motion faster. We can get those muscle fibers to start firing a lot faster. And certainly in our patients that get to outpatient with the X10, who really were significantly limited in their range of motion prior, we're able to see that strengthening over that longer range happen faster. Because with the X10, we can focus specifically on this particular range and be very accurate with it because of how we can set the machine.
Okay, that's it. A short and sweet podcast on a very important topic. Keep listening, keep sharing, keep commenting. All your feedback is welcome. You can reach us at thebeeskneespodcast@gmail.com. You can see a lot more great content at x10therapy.com. You can /blog or just look up any of the topics that you're interested in. We've got a wealth of content there. There are a number of private Facebook groups online that we support as well. So there's a whole dialogue going on that you can learn about when you get to the website. Thanks for listening. I'll see you next time.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.